This is a simple how do I video on how do I do simulation. I'm going to begin by introducing our mannequin or our patient for simulation. His name is either Bob, Jane, Sally, Dick, Joe, whatever your scenario is. He simulates a regular patient. He can sweat, he can have tears, he can have mucus coming from his nose, he can drool if it's a drooling situation. You can check cyanosis of his lips. He has blue lights in his mouth that you look for. You can give him injections, IM injections, sub-Q injections, IV injections. You can check pulses. You can listen to heart sounds, lung sounds. Now you can talk to your mannequin and he will talk back. You'll have to listen very closely. The sound comes out of his ears. So when you're listening to him, you'll need to listen very closely. Okay? Since I mentioned being able to talk to your mannequin, we're going to hold a little conversation. Can you give me your name and your date of birth?
My name is Bob the Builder.
Bob.
And I was born January 1st, 1940.
Okay, so your name is Bob the Builder. Your birth date is 1/1/1940.
Yes, it is.
Thank you. The next question is, how do I work when we talk about the mannequin? I'm going to expose his chest so you get an idea as to where to listen. When you're listening for heart sounds and lung sounds, you have all of these spaces to listen. And if you go ahead and just listen, you can hear actual lung sounds as he's breathing. Heart sounds, same thing. Listen in the same place. Aortic, pulmonic, Erb's point, mitral, tricuspid and mitral, kind of in the same area on this mannequin. Now, he does not have speakers on the back, so you can only listen to lung sounds on the front. Okay? Same thing with the abdomen. You go down to the abdomen, same thing. You can percuss it just like you normally would. You'll hear sounds. Then you go to listen. You can listen to the bowel sounds. Okay? Same thing. All four quadrants, just like you normally would. While I have this area exposed, I'm also going to show you where you would find his femoral pulse. The pulses are these spongy points. Here's his femoral pulse. We have a popliteal pulse that's right here next to the knee. It's kind of a spongy point. Now, don't push on those too hard or you won't get a pulse. You just lightly hold your finger over those. Same with dorsalis pedis. We have a pulse. Brachial or Achilles posterior tibial is down here on the bottom of the foot or on the ankle. Radial. There is no ulnar here. The brachial is way up in here inside his arm. It's like right in here. So it's not the true brachial. Okay?
Okay, next we're going to show you that you can administer medications to the SimMan. The first one I'm going to do is give an IV push. So I'd cleanse my hands, get my alcohol, making sure to scrub the hub. It's a needleless system. I don't need to wear gloves. I've gotten the air out. I'll be flushing the IV. And you can go ahead and flush. There is a container inside the arm that collects the fluid. And if you had an IV running, that would be here with the appropriate amount of fluids running. So you can see that Sharps container. Next, I'm going to give our simulation man a subcutaneous injection. I've verified the medications already and checked identification. And so for subcutaneous, we can go ahead and just utilize the abdomen and simulate pinching up the skin. administering that medication. And Sharps container again. And as I put this in the Sharps container, I'm going to come over to the other side of the bed to give my IM injection in that left upper arm. Aspirating, because it's not a vaccine. Slowly administering. I'm applying some pressure. Then onto the Sharps container with this. Okay, one of the last things we wanted to show you on the Simulation Man itself is that you can provide for a full neurological exam, including checking the pupils for dilation and constriction. So if you want to come up here, you can see that as I shine the light to the mannequin's eyes, his pupils do react.
Now that you've learned a little bit about the SimMan, we're going to talk about the monitor. So when you're ready to take his blood pressure, you'll go ahead and put the blood pressure cuff on his arm. You're going to touch the screen, and then you're going to touch it again. Hit start, and you'll hear the noises and the cuff is going. After it's read, you'll get a reading out here. Takes us. There you go. And that's how you do blood pressure. To get your ECG, you just touch there and you'll get that. To do the SpO2 sensor, you just want to take this, go ahead and just clip it to any one of his fingers, and it'll automatically start recording on the monitor for you. When it comes time to take his temperature, we want you to go ahead, grab the thermometer, and we're going to have you simulate taking the patient's temperature. And you will get the temperature reading on the screen. It'll be a number in green. As far as adding oxygen to the patient, any of the oxygen supplies you're going to need, cannulas, masks, are all going to be in the bottom of this cart here. Right now, our oxygen and suction is not currently hooked up to a compressor. We do want you to go ahead and simulate turning your oxygen up, and we need you to verbalize the level that you'll be putting it on.
And that concludes our orientation to the Simulation Man.
Thank you for showing your students how to provide care for me.
You're welcome.
Welcome to Northland Community Hospital, East Grand Forks Simulation Room. You've previously watched a video about the Simulation Man. This particular video, How Do I, is about the equipment and things in the room.
How do I work this bed?
This bed works like a barber chair. You pump the black pedal to raise it up. To lower it, you push the other side, the other pedal, and it'll go down. The railings are pretty self-explanatory. They have a black bar. You pull that black bar up, and the railings fall down. Okay? To raise the head of the bed, there are two silver bars back here that you pull, that you squeeze that bar, and it raises the head and it lowers the feet at the same time. You release that bar and the bed will stay in that position.
How do I know what's over here?
Well, over here, Lisa, this is your sink, your soap, towels, wash your hands. This is your workstation. On this workstation, you've got cups, you have an emesis basin, you have another pen light in case a pen, your drug handbooks, a mask if you need to wear a mask. You should not need to take anything out of these drawers. This is just a workstation. It's just so you have a table to work off of. We also have gloves and an extra stethoscope if you would need those. Now the clock in this room, make sure you pay attention to your handoff report, because the clock will not be adjusted according to the time of the scenario. It's just here to use so that you have it for a second hand when you're giving medications. Okay, so pay very close attention to the time that you're given in your scenario.
If you're looking for supplies during your simulation, they will be found in the bottom of this red cart. You won't be needing anything in the top portion, as we used to store medications in there. The top drawer of this bottom cart is going to have all of your supplies needed to do a dressing change. The second drawer is going to be your needles and syringes. The third drawer has IV supplies. And the fourth drawer has catheter supplies, NG tube supplies, colostomy supplies, and some sterile gloves. If you need to get a hold of the doctor during your simulation, you want to use this phone and dial the number that is in yellow, 2878. So this is our Pyxis machine. When you need to get your patient's medications, they will all be located in here. You're going to want to go ahead and sign in with the sign-on name and password. The sign-on name and password you're going to use is on this pink sticky note right on the top. This is just telling you that everything is fake medications. Just go ahead and click OK. You're going to want to dispense to patient and type in your patient's name. Today I'm going to be using the practice patient. That patient's name is Practice. You'll touch on that. We're going to be getting them some Tylenol. This is an allergy warning, making sure that you checked your patient's chart for allergies. I only want to give my patient one Tylenol tablet, so I will go ahead and select one. A thing to note is that if you are going to get IV injectable medications, you're also going to want to put in one because you only want to take one vial from the cart. Go ahead and click enter. And when you're ready, you're going to go ahead and push here to open the drawer. Also of note, the last dispense date and time is going to be for the current day. That is because the simulation group of students ahead of you has also gotten the same medication. We're just going to ask you to go ahead and ignore that. We'll push that to open the drawer. Maybe, there we go. And the drawer will pop open. You'll pull the drawer open, and I am looking for my acetaminophen, 500 milligrams. I'll take what I need. I'm going to go ahead and close the drawer, and I'm going to push here when I am finished. I am then going to log off and exit because you don't want to leave a Pyxis machine open. And that concludes how you would run the Pyxis. If your patient needs medication during a simulation, you will go to the Pyxis to retrieve that. After you've done that, your instructors would like you to bring your medications, get your supplies, and bring everything over to this countertop so that they can observe you. Due to the unique nature of simulation experiences, we do ask that all participants agree to keep the details of the scenarios and individual performances confidential. Please, do not discuss or share the scenarios with your fellow students so they can have the same learning experience. Thank you.
This concludes your orientation to the East Grand Forks Simulation Room and How Do I Do Simulation.